My name is Don Ingram, and for those of you who were here the last two conferences, you should recognize me. I'd like to first say, see a show of hands of those who were at our first conference. Can I see that show of hands? Okay, great. Who was here last year? Terrific. So at least it was good enough to get you to return, and we do appreciate that. Now, next order of business is there's been some issues with the volume. Can you hear me in the back? Who can't hear me? Raise your hand. Okay, so we're doing pretty good now on the volume. All right. Well, again, welcome. My official duty is to welcome you on behalf of the Pennington Biomedical Research Center. We're very proud again to have this conference co-sponsored by the NeuroMedical Center, and you'll hear a couple of words from Dr. Calegan in a minute regarding that. Again, we're just thrilled to see the auditorium filled up again. We have a great program for you today. I'd like to give credit not only to those in attendance, again we appreciate it, but to get you here took hard work throughout the year, and you'll see the members of the organizing committee responsible for that. Dr. Katrine Tudor-Locke is here, Dr. Zhang, Dr. Brantley's not here. Unfortunately, he's on a barge boat in the south of France. So our regrets to him. Yeah, and Ann really is responsible for all the logistics that you're seeing in operation, full operation today. So, and she's already helped get you further oriented with her comments. Then, as I said, our partners at the NeuroMedical Center, Dr. Calegan, Dr. Kader. And then really we're here due to the instigation or motivation of support group Movers and Shakers, and our two representatives from that support group, Carol Harrison and Randy LeBlanc, have been indispensable throughout this whole process, and we're really appreciative of their dedication to this effort. Now, the major objectives when we first organized to bring you this conference is shown here. Bring together experts in Parkinson's disease to inform the patients and their caretakers, as well as the general public, including professionals, about causes, management, and treatments for the disease. And you'll see that our program fulfills that today as it has in the past. And then really an underlying objective was to stimulate interest in participating in research projects. Now, so far, we've not been able to secure funding to get started in research here at the Pennington Center. What I can tell you is that we're very close to that. We managed to raise money from a few private sources to get us started. We've also added a number of new resources at the Pennington Center. I don't know if Dr. Carmichael is here yet. There he is, way in the back, waving his hands. Owen Carmichael joined us from the University of California, Davis, just first part of June. And many of you driving in saw the imaging center, which is now almost fully operational. Owen, yeah, fully operational, and that's going to provide an incredible new research arm, not only for neurological disease at Pennington, but also for a wide range of other diseases, metabolic diseases. So we're making progress, and I believe we will have something operational this year. So again, thanks for your support. Now. We have a good model to follow for getting Parkinson's disease research off the ground here at Pennington. Many of you know about this program. Did anyone participating in Dr. Keller's program or know about it? Yeah. So Dr. Keller arrived the same time I did at Pennington in 2007, and with a lot of community support, he was able to launch a major program in Alzheimer's disease research, and they're now sponsoring 3 clinical trials here. So if you don't know about the program, you can find out more about it on our website. If you know persons affected by this disease, you can have them contact the program through that website. And really, there are now a couple thousand people throughout the state participating in this program. And if you want to find out more about clinical trial participation in general, as you know, here at Pennington we have a number of clinical trials always ongoing. Many of them are directed to nutrition and treatment of obesity and diabetes. But you can also find out about the clinical trials that Dr. Keller has ongoing as well. We promise not to harm you, and you will benefit not only yourselves, but the scientific community by your participation. And I tell people visiting Pennington that this is an incredible place to do science because we have such support from the community. You know, there are a lot of places, particularly urban areas, larger urban areas, where you'll get recruitment to clinical studies, but then you have a major dropout. They just don't return and participate. But here in Baton Rouge, and particularly through the clinical trials we sponsor at Pennington Center, we have incredible compliance. So once people enroll, they stay with us, and that promotes the science. So again, you can find out more about clinical trials there. Want to recognize people who have been responsible for us being here as well, and that's our major sponsors. They have provided funding for getting our out-of-town speakers here, for the wonderful refreshments you're enjoying today, and we really do appreciate their efforts. Also, many of you I was glad to see are already visiting the exhibitors. There's a lot of incredibly useful information out there that will be very helpful to many in the audience, and we appreciate the exhibitors' participation as well. So this makes it a really educational day. You can find out about many resources that are available to you. Now, the program, as I said, is another success. We've shortened it up a little bit. We had some feedback that the day got a little long, so we've shortened it up a little bit, you'll see. But we're going to, again, meld different topics together. One we'll start off with is basic mechanisms of Parkinson's disease. Will be given by Dr. Deutsch, who comes to us from Vanderbilt University. Then we'll have a break. Again, that'll be a chance for you to visit exhibitors and also ask questions during this break if you want to approach the speaker. We're not going to take formal questions after each talk, where you can either do that or, like Ann explained, we'll have a very lengthy question and answer session this afternoon. Next, we'll follow up with a topic that gets into the clinical implications of Parkinson's medications, and an update, a very timely update by Dr. Whedon, who is from the NeuroMedical Center, one of the staff there. Then we will have Dr. Maya Shees address cell therapy and Parkinson's degeneration, a topic I know many of you in the audience are very keen to hear about. We'll have, as Ann explained, a very long lunch and exhibit viewing opportunity for you there. Again, a chance to ask questions directly to the speakers if you're so motivated. And finally, we're very, very fortunate to have the Vice President for Research and Engagement, Ms. Claire Meunier, from the Michael J. Fox Foundation for Parkinson's Research, who's going to give you sort of a bird's eye view of research update and opportunities to get involved that their very, very innovative organization is helping to promote. And then, as I've already said, there'll be a really lengthy session for you to get your questions answered, listen to the discussion. Through the feedback that we've been given from this conference, this turns out to be one of the most important elements of the conference, so we really want to emphasize it, and we have this year. So, it is one of the community education events that I'm proud to say Pennington does throughout the year. Who else? Who's attended other conferences here at Pennington? Yeah, we're very proud of our educational mission. Ann is responsible for many of these events that happen throughout the year, and we get incredible participation and feedback. So again, thanks to our sponsors, and I'll have a few words now from Dr. Gerald Calegan from the NeuroMedical Center.
I want to thank you all for coming out. I see a lot of familiar faces here. Thanks to all of you for helping making this a big success. I want to thank Don for his great comprehensive introduction, and thank you to all the appropriate people. One of the main objectives we've had in this conference is to get some research going, and I'm happy to report at the NeuroMedical Center we've finally done that. We've partnered with a company called Intrafusion, and we have a research coordinator, Debbie, who's here somewhere. Debbie, there she is. And we actually have our first Parkinson's study at the NeuroMedical Center. It's in full swing. We've been very successful. We've really out-recruited a lot of big centers thanks to you all, and what Don said is exactly right. The enthusiasm for research here is like I've never seen. You know, people go out of their way to want to be in these studies, and I think that's going to advance the field and that's what we all want, of course. So I'm excited about that. We're also going to do research in other areas in neurology. We're looking at studies for multiple sclerosis and migraine and lots of things, but I want to focus on movement disorders, of course. So we now have 3 movement specialists at the NeuroMedical Center since Dr. Whidden has joined us in the past year. So she's been here about a year now, and she's going to talk with us today in the afternoon about Parkinson's medications, and so we're glad to have her on board, and thanks again for everybody for coming.